Good afternoon. My name is Gary Herbst. I'm the Chief Executive Officer here at Kaweah Delta Healthcare District, and I'm coming to you today from the Kaweah Delta Medical Center downtown. And I greatly appreciate you giving me a few moments in your busy days to address many of the questions that are coming our way relative to obviously the coronavirus and what Kaweah Delta is doing to care for our community and protect our community and taking care of our 5,000 employees, our almost 700 physicians and advanced practice providers. And so again, I greatly appreciate the tremendous outpouring of support that we're receiving from the community, social media, personal emails to me, just expressing your appreciation for us being here for the community. And as I've said many times, we really consider it to be our privilege, our honor to take care of this community. And I couldn't be more proud of just the amazing, selfless people that are coming to work every single day to really take care of other people, to take care of their friends and their families and their neighbors. I couldn't be more proud, I couldn't be more grateful to all of them. And so on their behalf, I just want to say again, thank you to all of you. Thank you for the support of some of the difficult decisions we're making. Just obviously yesterday, we put in a no visitor policy to the acute medical center. It's something we'd done a couple days or last week with respect to our skilled nursing facility on Court Street and our mental health hospital and rehab hospital on our West Campus. So very, very difficult decision. Particularly when people are in the hospital. Obviously it's a very anxious, scary time for folks, and it's a time where you want to be surrounded by family, to be comforted and supported. And so it was very, very difficult to do, but again, it's the right thing to do under these circumstances to protect our visitors, to protect all of you, to protect our workforce that is taking care of you today and will be taking care of you in the coming days. So again, thank you. For allowing us to do that. So I've had a few questions that I'd like to address that have come my way. First one, is every patient admitted to the hospital being swabbed for the coronavirus? And the short answer is no. We have many patients, as you can imagine, that come to the hospital. They come for heart attacks, they come for strokes, they come for surgery, they come for trauma, they come for a variety of reasons. And they come with absolutely no respiratory conditions whatsoever. They're not exhibiting fever or coughs or sneezes or anything that are symptoms of the coronavirus. So we do not just automatically swab them. If we did, this country would quickly run out of supplies. We'd run out of the things that are required to collect specimens, and we'd absolutely run out of the testing supplies. So we have to be very judicious, very prudent in our use of supplies. So again, the short answer is no. Now that said, patients that do present with visible or apparent respiratory conditions, they are coughing, they are sneezing, runny nose. A lot of times, things that you would see with a common flu or a cold, but they also have a temperature, and generally 100.4 or higher is cause for concern that they could have the virus. In those circumstances, we absolutely do swab the patient. We also screen them. There's an algorithm that was put out by the Centers for Disease, CDC, that travel, contact, things of that nature. And so if they meet those criteria and they're definitely exhibiting those type of symptoms, then we do collect a specimen. We send it to the county public health department for testing. We generally are getting the results back sometimes as quick as the next day, and I want to applaud our county health department and their lab for doing an outstanding job supporting us. But then if the results come back positive, then we really kind of assess the patient. So if the patient appears to be otherwise healthy and is not really exhibiting the more advanced symptoms, they don't look like they have the onset of pneumonia or other more severe respiratory issues, then we're going to send them home and look for them to recover at home. And the vast majority of Americans have been recovering at home, quarantining themselves. Obviously, we're checking in with them all the time. We're monitoring them, making certain that their symptoms are subsiding. If they're not, if they appear to be advancing, then we definitely would bring them back to the hospital. So that's kind of I guess maybe the long answer to that particular question. A question about personal protective equipment, what we call PPE, and if hospital staff are being given adequate equipment. So again, there are very carefully designed protocols of when to use personal protective equipment and when not to, when it's warranted, when it's not warranted. And that applies to both healthcare providers as well as to patients. So generally, the first person to receive PPE is the patient themselves. So if a patient were to come in and test positive for the flu, or a patient comes in with an active respiratory issue where they're coughing and sneezing and expelling micro droplets, first thing we do is we put a mask on them. And that is to really protect the care providers. The patient has already been infected with the flu or the coronavirus, but this is now to protect the people taken care of. So we then determine who's going to be caring for that patient, what personal protective equipment should they be wearing, which often are always gloves, but also gowns, N95 masks, surgical masks. They might be wearing a shield for further protection. Again, each patient is assessed, what the risks are, and we do provide that appropriate equipment to them. I think there's been some concern too that we have an inadequate supply of equipment, and therefore we're making employees use the same PPE over and over again, and that's not true. There definitely, again, this is all spelled out in the CDC protocols, but if you happen to be a nurse and you're taking care, let's say many hospitals are now developing dedicated COVID-19 wards, patient wards, where if they had 4 or 5 inpatients that all had the condition, that they would all be cohorted into a single area. In that circumstance, all those patients are wearing masks, but if we have a single physician, a single nurse that's taking care of them, then they can wear that N95 mask throughout the entire day, and they could be treating all of those patients while wearing that single mask. But generally, we do not ever allow an employee to continuously use a mask day over day over day. They are changed out, again, when appropriate, following that algorithm. Now we have, like many hospitals, we have been running low on supplies. But fortunately, with the president declaring a national emergency, that freed up the national stockpile of personal protective equipment, which is now flowing to the states and flowing to the counties. So we work directly with the County of Tulare, again, the Department of Public Health, to access additional supplies. We put in our request just last week, and earlier this week, we were delivered 19,000 N95 masks and about 17,000 surgical masks. I'm asked often about ventilators. So ventilators, when you need to intubate a patient that has, say, pneumonia and is struggling to breathe on their own, and that's when you have the advanced stages of coronavirus. That's generally how it manifests itself, through pneumonia. So in those cases, if a patient needs to be on a ventilator, we have 104 ventilators throughout Kaweah Delta. 9 of them are designed for pediatric patients. The rest are for adult patients. We do have a number of ventilators that are in use right now, but we have about 50 of them that are in stock, in inventory, currently not being used. We only have 2 patients that are in-house right now that have tested positive for coronavirus. So again, most patients that have tested positive, and just earlier this morning, just minutes ago, our Media Relations Department gave me a news release that just came out from the County Health Department that Tulare County now has its 7th confirmed case. These last 2 cases actually are younger people. The 6th case is a patient between the ages of 18 and 24, and the 7th patient is between age 25 and 40. And my understanding is they've been sent home, they're quarantined, and are otherwise healthy, have not been admitted to the hospital. So the hospital is pretty full right now, but again, not of coronavirus patients. We're still battling the flu, other respiratory conditions, patients that do have pneumonia, but completely unrelated to the disease, and then just the things hospitals treat all the time. So our staff are in excellent shape relative to personal protective equipment, and we are using it every single time as appropriate to keep our staff and our providers safe and protected. There was further action that was taken by the President yesterday that also, I understand maybe is just enacted during wartime, where factories are put on higher production. And so the President has asked factories to step up their production of masks and gowns and gloves and ventilators. So I don't know how long it takes to manufacture a ventilator, but very pleased to see that action is taking place. Obviously, we hope we never, ever get to that point, but always have to be thinking into the future and planning for it. I got a question that I am a high-risk pregnancy patient scheduled to have a C-section on April 4th. Is there a possibility policies will change by then to a no visitor policy at all? So you probably read that with great discussion and difficulty, we did make the decision a couple days ago that with respect to the acute medical center here that we did institute a no visitor policy, which again is very hard for us because our mission statement itself, the last line of our mission statement is compassion is our promise. And as I said before, when you're in the hospital, other than having a baby, it's generally a very scary time. And surrounding yourself with visitors is very important at that time. So trying to balance being compassionate with also wanting to protect the health and well-being of our community and our patients and our providers, and not to unnecessarily expose them to the virus by allowing so many visitors to come into the hospital. That's really what's prompted us. And we're in a very long line of hospitals. Every day I'm reading that most hospitals have adopted the same no visitor policy. But there will be exceptions. So certainly patients that are at end of life and palliative care, hospice, we absolutely want them to have a visitor that can stay with them their entire stay. Ideally, it's the same visitor that is there, again, trying to minimize the number of contacts, but we will make exceptions if that visitor themselves becomes sick or becomes exposed to the virus or simply is physically exhausted and can't stay there, then we would permit an exchange of that visitor. And then pediatric patients, NICU patients, minors that really need an adult, a parent or other caregiver to be with them, that's absolutely an exception as well. Patients that are suffering dementia or might be developmentally disabled and have difficulty making decisions on their own or expressing themselves that have a caregiver, again, whether it's a family member, a friend, or oftentimes an agency here in town that provides that support, then exceptions will be made in that case. And then also labor and delivery. So a mom that is in active labor that presents to Kaweah Delta, absolutely. We want dad, significant other, caregiver to be with that mom through the entire delivery and their entire stay and the baby's stay. So again, that will absolutely be an exception. I don't see any scenario with respect to this mom that they would not be permitted to have a visitor. Depending on how conditions change, and you know they're evolving quickly. We literally, we have a command center that is staffed 24 hours a day. I meet with them every single day at 2 o'clock, and we're making decisions, changing decisions as circumstances change. So there may be changes that occur to our visitor policy, but it might be now that, you know, Dad's going to have to now be wearing personal protective devices, shields and gowns and gloves. But I do not see a circumstance where we would not permit Dad or the person's significant other not to be there with them. And then what are you doing to keep patients and their families connected? So obviously, with this visitor policy and our commitment to compassion and the healing process that comes with having friends and family and support, we are now exploring all these different means by which we can keep patients connected to their family and friends. So there's been some relaxation of HIPAA rules. So under patient privacy, you know, generally no video recording, no sound recording of patients. Again, trying to balance that compassion with protection of privacy as well, is that we are now working with our ISS department, our IT department, to provide iPads, phones, teleprompters or telehealth screens, other video and sound means where patients can talk, you know, FaceTime or Skype or streaming video, live streaming, so that they can talk with their family and friends. So if patients have those devices themselves that they can come in with, that's great. But if they don't have the devices, then we will provide them with those devices and help the patient as well as their family members connect. So those are the four most recent questions that have come our way. But again, we really see ourselves as Kaweah Delta as really taking the most prominent role in this community during this very uncertain, anxious time. We want to be the entity that brings some level of comfort and peace of mind to folks, that you know that there's somebody that is here to take care of you. And so we want to be an active source of information, of accurate information, up-to-date, timely information. So I strongly encourage you to look at our website, to look at our Facebook page, to look at our Instagram, Twitter. I'm not certain everything we're using these days, but we're posting information all the time. It's also, if you have questions, it's a great way for you to reach out to us. And I'd like to do these periodic kind of virtual town halls with the community to address some of these questions right in the moment. Definitely reach out to our media relations department. Laura Flores McCusker, always willing to take your calls and be there for you. So again, thank you to you for giving us your trust and confidence to take care of you, and we'll talk to you soon.